Bismillahirrahmanirrahim. And quote for the day, Allah says in Holy Quran, surely we never discount the reward of those acting righteously. The topic for today's presentation is neonatal care. I am Dr. Ayesha AminPGR of FCPS Community Medicine at Institute of Public Health, and I will be presenting this topic under the kind supervision of my supervisor and teacher, Professor Dr. Saira Afzal, who is the Dean of IPH Lahore. So the learning outline for today's presentation would be introduction and importance of neonatal care, essential newborn care, neonatal assessment, screening and immunization of neonate, care of preterm and low birth weight babies, public health and community care, burden of neonatal morbidity and mortality, recent updates, and multiple choice questions. Learning outcome. By the end of this presentation, the participants would be able to describe the importance and essential components of neonatal care, care of a preterm and low birth weight baby, the epidemiology of neonatal morbidity and mortality globally and in Pakistan, and to be able to answer the multiple choice questions. Introduction. The neonatal period is defined as the first 28 days of life, and it is the most vulnerable time for a child's survival. This brief window carries the highest risk of mortality compared to any other age group in childhood. The quality of care a newborn receives during these first days directly influences immediate survival, long term growth, neurodevelopment, and overall health outcomes. Neonatal care focuses on ensuring that every newborn transition safely from intrauterine to extrauterine life. So, why neonatal care matters? Neonatal care is essential because it directly influences the survival. Effective care during birth and first hour can prevent the majority of neonatal deaths. Brain development, early nutrition, thermal regulation, and infection prevention protect neurodevelopment. Long term health, poor neonatal care increases the risk of chronic diseases, stunting, cognitive delays, and disabilities. Maternal well being, good newborn care supports early bonding, breastfeeding, and improved maternal health. Public health impact, reducing neonatal mortality drives overall improvements in population health indicators and align with the Sustainable Developmental Goals. So, what are the types of neonatal care? The neonatal care is broadly classified as early neonatal care and late neonatal care. Coming to the early neonatal care, the early neonatal period is defined as the period from birth to the seventh complete days of life. This is the most critical window because more than 70% of neonatal deaths occur within the first week, especially within the first 24 to 48 hours. The objective of early neonatal care is establishment and maintenance of cardiorespiratory functions, maintenance of body temperature, avoidance of infection, establishment of satisfactory feeding regime, and early detection and treatment of congenital and acquired disorders, especially infections. So the components of essential newborn care is immediate drying up, stimulation and cleaning the airway of the neonate, measuring the APGAR score, care of the cord, care of the eyes, care of the skin, maintenance of body temperature, and the early initiation of breastfeeding. So, immediate drying, stimulation, and clearing the airway. As soon as the baby is born, the newborn must be dried thoroughly with a warm cloth or towel. This removes amniotic fluid and prevent heat loss through evaporation, which is a major cause of neonatal hypothermia. Drying also helps stimulate breathing naturally. Avoid after drying. Gentle rubbing on the back or soles of the feet helps maintain and initiate effective breathing. Most newborns start breathing on their own. Stimulation helps clear the airway secretions and reduces the need for further resuscitation. Avoid vigorous shaking or slapping on the back of baby for the stimulation so that the baby start crying. Next component is the measurement of APGAR score. The APGAR score is a quick clinical assessment of a newborn condition immediately after birth. It provides an immediate estimate of the physical condition of the baby. It evaluates 5 vital signs to determine how well the baby is adapting to the life outside the womb at 1 minute, and the score at 5 minutes tells us whether the baby needs resuscitation or not. Each sign is given a score of 0, 1, or 2. A perfect score should be 9 or 10. The score of 0 to 3 indicates that the baby is severely depressed. The score of 4 to 6 tells that the baby is moderately depressed, and a score of below 5 demonstrates that the baby needs prompt action. Infants with low APGAR score at 5 minutes of age are subject to a high risk of complications and death during the neonatal period. So this is the diagram which is showing the APGAR score. The APGAR score has five indicators which are activity, pulse, grimace, appearance, and respiration. And each of these indicator has given the point 0, 1, and 2. The point of 0, it represents the absence of activity or pulse, floppy grimace. Appearance can be blue or pale in this category, and respiration is absent. While at the point 2, it represents the activity that the baby is active. The pulse is over 100 beats per minute, and the baby is giving a prompt response to stimulation. The appearance of the baby is pink, and if the baby has a vigorous cry, then he gains 2 points. So care of the cord. The next important component is the care of cord. The umbilical cord is clamped 1 to 3 minutes after birth once the cord stops pulsating. The benefits include increased blood volume transfers from placenta to baby. It reduces the risk of anemia in baby, and better iron stores are there for baby for the first months of life. The contraindications in which you cannot wait for 1 to 3 months after the baby is born, whenever there is urgent need for the resuscitation away from the mother, or if the mother has a maternal hemorrhage, so you immediately cut the cord. Care must be taken to prevent the tetanus of the newborn by using properly sterile instrument and cord ties. It is essential to apply an antiseptic preparation on the cord stump and the skin around the base. The cord should be kept as dry as possible. It dries and shrivels up and separates by aseptic necrosis in 5 to 8 days. Next is the care of eyes. Before the eyes are open, the lid margins of the newborn eye should be cleaned with sterile wet swabs, one for each eye from inner or outer side. Eye prophylaxis, when recommended, it prevents ophthalmia neonatorum. The common agents which are used for the prophylaxis are 1% erythromycin ointment or tetracyclines, or freshly prepared silver nitrate 1% solution. The next is care of the skin. When a baby is a few hours old, the first bath is given with the soap or warm water to remove vernix, meconium, and blood clots. The first bathing should be done by the nursing staff. Thereafter, no further bathing is necessary until the day before discharge. The first bathing can be delayed up to 12 to 24 or may be delayed up to 48 hours after birth to avoid cooling of the body temperature of the baby. The next is the maintenance of body temperature. The normal body temperature of the newborn is around 36.5 to 37.5 degree. A newborn is projected to out of warm womb of the mother into an environment which may be 10 to 20 degree cooler, especially in winter months. So as much as 75% of the heat loss can occur from the head of the baby. So it is important that immediately after birth, the child is quickly dried with a clean cloth, wrapped in warm cloth, and given to the mother for a skin to skin contact, and breastfeeding should be started. The skin to skin contact, that is kangaroo position, the baby is placed directly on the mother's chest immediately after birth. So the benefits of kangaroo care is it maintains body temperature, regulates breathing and heart rate, promotes early breastfeeding, and enhanced bonding. And it is of special importance in case of preterm and low birth weight infants. So next important component is the early initiation of breastfeeding. The breastfeeding should start within the first hour of life. So the initial milk which comes out is colostrum, which is rich in antibodies, especially IgA. It enhances immunity and improve mother-baby bonding, and it also protect neonatal hypoglycemia. The delayed initiation increases the risk of neonatal infection and mortality. Supplementary feedings are not necessary. The regular milk comes out on the third to sixth day after birth. The baby should be allowed to breastfeed whenever the baby wants. Feeding the baby on demand helps the baby to gain weight. It is very important to advise mother to avoid bottle feeding. So, maintaining the warmth of the child through the warm chain. The warm chain is a set of practical steps to prevent newborn hypothermia from delivery through postnatal care. It includes warm delivery room, which has a temperature around 25 to 28 degree, immediate drying, skin to skin contact, breastfeeding early and frequent, delayed bathing for at least up to 24 hours, appropriate clothing and bedding, rooming in with the mother, warm transportation if the referral is needed, training the caregivers on thermal protection, and awareness at community level. Hypothermia is dangerous because it increases the risk of sepsis, respiratory problem, and mortality. The next component is neonatal assessment. One, the initial steps are done, the next important step is neonatal examination. So the first examination is made soon after birth and preferably in the delivery room. This examination is to ascertain that the baby has not suffered any injuries during the birth process, to detect the malformation, especially those requiring urgent treatment, and to assess the maturity of the newborn. The second examination should be done preferably by a pediatrician within the 24 hours after birth. This examination should form the first stage of a continual of healthcare surveillance of the baby. It is a detailed systematic examination from head to foot conducted in the good light. So the next is measuring the baby. So the first component is the birth weight of the baby. The most important indicator of the intrauterine growth and newborn health is the birth weight. The birth weight should be taken preferably within the first hours of life before significant postnatal weight loss has occurred. The naked baby should be placed on a clean towel on the scale pan. So why birth weight is done? It detects low birth weight baby, prematurity or macrosmia. The normal weight range of the weight is 2.5 to 4.4 kg for the term newborns. So the classification, low birth weight is defined as the babies which are born with less than 2.5 kgs. Very low birth babies have the weight of 1.5 kgs, and extremely low birth weight babies are the babies who have the weight of only 1 kgs, while the macrosmic babies are defined as the babies who have the weight of 4 kg, and they are most commonly seen in the mothers who have gestational diabetes mellitus. So length, crown heel length, it is measured when baby laid straight on an infantometer, measured from top of the head to heel with legs gently extended. The normal range is 48 to 52 centimeters of newborn, which are basically the term newborns. Importance in it is used to help assess the skeletal growth, and it distinguishes symmetric versus asymmetric growth restriction. Then the next important thing is head circumference or occipitofrontal circumference. It is measured by measuring a tape placed around the head just above the eyebrows and over the most prominent part on the back of the head, that is occiput. The normal range is 33 to 35 centimeters for the term newborns. The importance of head circumference is that it reflects the brain growth and intracranial development, and it dictates the microcephaly, hydrocephalus, and congenital infections and developmental abnormalities. Then the next thing is neonatal screening and immunization. Newborn blood spot screening can be done in cases of can be done for G6PD deficiency, congenital hypothyroidism, and certain metabolic disorders like phenylketonuria. The important things which should be given to the newborn baby is first vitamin K administration. It is given as 1 milligram of intramuscular vitamin K soon after birth to prevent vitamin K deficiency, which can lead to the bleeding or hemorrhagic disease of newborn. Without vitamin K, the newborns may develop life-threatening bleeding. The next is the important vaccination which should be done. The first is BCG, which protect against the TB meningitis or the miliary TB. It is given intradermally at birth. And then the next is OPV 0, early protection against polio. 2 drops are given at birth. And then the hepatitis B vaccination, which should be given within 24 hours to prevent the mother to child transmission. And to protect the baby from hepatitis B, it is given as IM injection. Then comes the late neonatal care. The late neonatal care, the late neonate is defined as the baby from 8 to 28 days of life. Death in this period are usually due to the preventable infections and feeding problems. And the neonatal care, late neonatal care is more usually a home-based care. So priority focus areas are in late neonatal care is monitoring the growth and nutrition of the baby. There should be exclusive breastfeeding continuation, adequate weight gain monitoring should be done, and managing breastfeeding issues like mastitis and poor latch. Infection prevention and detection. There can be late onset infections are common, which is the most commons are sepsis, pneumonia, skin infection, and diarrhea. And the signs which need immediate referral of the newborn or late neonate is fever or hypothermia, poor feeding, lethargy, or fast breathing or chest and groin. And the next important component is the care of a preterm and low birth weight baby. So the preterm is defined as the babies who are born alive before 37th week of pregnancies are completed. There are subcategories of the subcategories of preterm birth based on gestational age is extremely preterm, the babies which are born less than 28 weeks of the gestation, very preterm which are born between 28 to 32 weeks of pregnancy, and moderate to late preterm which are born between 32 to 37 weeks of gestation. Their intrauterine growth may be normal. Their weight, length, and development may be within the normal limits for the duration of gestation. So if they are given good neonatal care, the babies can catch up growth normal. Low birth weight baby, the birth weight of less than 2.5 kgs, regardless of the gestational age, is known as low birth weight baby. As we have already talked about, the very low birth weight is defined as the birth weight of less than 1.5 kg, and extremely low birth weight is defined as the birth weight of less than 1 kg. So these neonates are extremely fragile, and they usually require neonatal intensive care units care. And these infants often have immature organs like lungs, gut, and brain, and for this reason, they need specialized support. So, the component of the care of a preterm and low birth weight babies, the initial steps are almost same in the care of baby, which we have already discussed, like drying the baby, initial stimulation, early initiation of breastfeeding, and all that care of cord, care of eyes, and care of skin. The additional component is the kangaroo mother care. The kangaroo mother care is the gold standard for the stable preterm and low birth weight baby, especially in low resource setting. The components of kangaroo mother care is skin to skin contact, the baby placed upright on the mother chest for many hours daily. It helps in thermal regulation, improves breathing, and reduce infections. Then exclusive breastfeeding, it encourages early milk production and protect against infections. And then early discharge plus follow up, babies can go home earlier if the parents can continue kangaroo mother care at home, and regular monitoring at health facility should be there. So thermal regulation, preterm and low birth weight baby lose heat quickly due to the lack of fat, thin skin, and immature body systems. As we have already talked about, that hypothermia, it increases the risk of hypoglycemia, infection, respiratory distress, and mortality. So key steps in thermal regulation are the same. That is, maintain the room temperature at 25 to 28 degree, immediate drying after birth, provide skin to skin contact, cover head with a cap, wrap with the warm blankets, use radiant warmers, incubators for small babies, and delay bathing for at least up to 24 hours. Then feeding support, the preterm and low birth weight babies have weaker sucking, reflects poor coordination and higher nutritional needs. So the journal guidelines is that their breast milk is the best and first choice for the preterm and low birth weight infants. If they are unable to suck, so use cup feeding, spoon feeding, or nasogastric tube feeding. Increase feeding gradually depending on the baby's weight and tolerance. The feeding by weight, less than 1.5 kg baby, which are the very low birth weight baby, they should usually be fed with the nasogastric tube, which are given in small frequent feeds. The baby who have 1.5 to 2 kg, they can attempt get cup or spoon feeding, and kangaroo mother care improves feeding. And the baby who have over 2 kg of weight, they can be often given breastfed directly with the support. Then infection prevention, the preterm and low birth baby have underdeveloped immune system, making them highly susceptible to infections. So the key prevention strategies are strict hand hygiene for the caregivers, clean cord care, avoid harmful substances, avoid overcrowding and unnecessary handling, early exclusive breastfeeding for passive immunity, monitor for the sign of sepsis, which are poor feeding, fever, hypothermia, or fast breathing, prompt antibiotic treatment if the infection is suspected, and limited injection and invasive procedure in the newborn. The follow-up and long-term neurodevelopment, the preterm and low birth weight infant need regular follow-up because they are high risk for long-term complication. The follow-up include growth monitoring, in which weight, length, and head circumference is measured, feeding assessment, and breastfeeding support. Developmental review is done on vision, hearing, motor skills, and cognitive and social milestones of the baby. Immunization as per EPH schedule should be continued, and screening for anemia, rickets, and developmental delays should be done at follow-up visits. So the public health and community care in neonatal care, the community health workers, they play a vital role by visiting homes, educating mothers, supporting early breastfeeding, promoting hygiene, and identifying high-risk newborns early. Essential newborn care at community level includes clean delivery practices, thermal protection, exclusive breastfeeding, safe cord care, and maternal education. Home-based neonate care involves scheduled visit on day 1, 3, 7, 14, and 28 to assess the feeding, breathing, temperature, and danger signs, and refer to the baby whenever needed. Infection prevention focuses on hand washing, safe cord care, exclusive breastfeeding, reduced exposure to crowds, and early treatment of suspected sepsis. Referral system should be ensure fast transport and timely care of newborn with danger signs, which we have already discussed, that if there is poor feeding, fever, hypothermia, fast breathing, seizure, the baby should be immediately referred to a health facility which is well equipped. Social determinants, maternal education, poverty, water and sanitation and hygiene, cultural practices, they have influenced the neonatal health. So strengthening the community-based newborn care reduces infection, improves nutrition, increases immunization coverage, and significantly lowers neonatal mortality. Coming to the global burden of the neonatal mortality and morbidity, the first month of life is the most vulnerable period for the child survival, with 2.3 million newborns dying in 2022, according to World Health Organization. There are approximately 65,000 newborn deaths every day, amounting to 47% of all child death under the age of 5 years. The neonatal deaths, they have decreased by 44% in 2000. Still in 2022, nearly half, almost 47% of all death in children under 5 years of age occur in the neonatal period. In 2022, sub-Saharan African accounted for 57% of total under 5 death, but only 30% of the global live births. So, sub-Saharan African had the highest neonatal mortality rate in the world at 27 deaths per 1,000 live birth, followed by Central and Southern Asia with a neonatal mortality rate of 21 deaths per 1,000 live birth. Premature birth, birth complications such as birth asphyxia and trauma, neonatal infections, and congenital anomalies remain the leading cause of neonatal deaths. Children who die within the first 28 days of birth suffer from conditions and disease associated with the lack of quality of care at birth or skill care and treatment immediately after birth and in the first few days of life. Mothers who have received midwife-led community level of care provided by professional midwives, educated and regulated to international standards, are 16% less likely to lose their babies and 24% less likely to experience a preterm birth. So, a situation in Pakistan, according to the WHO, every day 675 babies under one month and 27 mothers die from preventable complication in Pakistan, amounting to over 99,800 maternal and 246,300 newborn deaths each year. Pakistan also registered more than 190,000 stillbirth annually. But over the years, Pakistan has made a significant progress. The neonatal mortality rate has declined from 52 deaths per 100 live births in 2006 to 37.6 per 1,000 live birth in 2024, and stillbirth fell from 39.8% per 1,000 live birth in 2000 to 27.5 per 1,000 live birth in 2024. So this is the map which is showing the neonatal mortality rate. The estimated share of the newborns who are dying before they reach the 28 days of life, and we can say that we can see that unfortunately the Pakistan is in the dark red zone, which is showing that almost 3.7% of the infants 3.7% of the infant, they are unable to reach the 28 days of life. So this bar chart is exactly showing the number of neonatal death in 2023, and we can see that the highest number of deaths are reported in India, but we know that their population is quite large than Pakistan. So if we compare ourselves with Bangladesh and Afghanistan and Indonesia, so we can see that the quality of newborn and maternal care is not well, and almost 258,588 neonates die within 2023 in Pakistan. And while Bangladesh has the neonate, almost 62,615 neonates were died. So the difference is quite large. So recent update, WHO response under the international theme of healthy beginnings, hopeful future. WHO is reiterating its commitment to partner with Pakistan to provide high quality healthcare to all mothers and newborn, leaving no one behind, as a vital step towards achieving the 2030 agenda and its sustainable developmental goals. So, universal health coverage and neonatal care aims at access to skilled birth attendance. It increases safe delivery practices, reduce birth asphyxia and maternal complication, affordable neonatal services, resuscitation, thermal care, phototherapy, antibiotic, neonatal intensive care unit care without catastrophic cost, strengthening primary health care, ensure antenatal care, essential newborn care, and continuity to follow up, reducing inequities. Poor, rural, and marginalized family can gain access to the same care as urban population, improving the quality of care, standard protocol for early newborn care, preterm care, infection prevention and breastfeeding support, and financial protection prevents families from falling into poverty due to NICU or emergency newborn care costs. So SDGs and neonatal care, the Sustainable Developmental Goals are directly linked to the improved neonatal outcome. The most relevant is the SDG 3, which states good health and well-being, and the target 3.2 state the end preventable neonatal and under 5 deaths. And the aim is to reduce the neonatal mortality rate to less than 12 deaths per 1,000 live births by 2030. So now it is the time for multiple choice questions. The first MCQ is: a community health worker visits a newborn on day 3 and finds that the baby cold to touch, lethargic, and feeding poorly. Which public health action is most appropriate? A. Advise more clothing and observe for 24 hours. B. Start home antibiotics. C. Immediate referral to a health facility. D. Give sugar water to improve energy. E. Recommend delayed breastfeeding.
C.
Yes, C is the right answer. Immediate referral to a health facility. The second MCQ is: a rural district shows high neonatal mortality despite good immunization coverage. Which indicator most strongly suggests a failure in essential newborn care? A. High BCG uptake. B. A low exclusive breastfeeding rate in first 24 hours. C. High OPV coverage, high zero dose OPV coverage. D. High vitamin K administration rate. D. High antenatal tetanus coverage. So the right answer is B, low exclusive breastfeeding rate in first 28 hours of life. The third MCQ is: a health facility audit reveals frequent use of harmful cord applications like ghee and ashes on the cord. Which public health strategy is most effective? A, punish families for unsafe practices. B, ban home deliveries entirely. C, community-based education on clean cord care. D, increase BCG coverage. E, prompt early bathing.
C.
Yes, C is the right answer. So community-based education on clean cord care. Fourth, our district report high number of preterm deliveries. Which public health intervention is most effective to reduce this burden? A, promoting early bathing. B, increase postnatal visits only. C, improving maternal nutrition and antenatal care. D, giving antibiotics to all pregnant women. E, delayed breastfeeding. So the right answer is C, improving maternal nutrition and antenatal care. The fifth MCQ is: a program evaluation shows high early neonatal deaths but low late neonatal deaths. Which area should be prioritized? A, NICU expansion. B, improving intrapartum care and immediate newborn care. C, increasing measles vaccine coverage. D, expanding school health programs. E, strengthening adolescent nutrition only.
B.
Yes, B is the right answer. The sixth MCQ is: a baby born at 36 weeks with the weight of 2.3 kg. Which public health classification is correct? A, preterm plus low birth weight. B, term plus very low birth weight. C, preterm plus extremely low birth weight. D, term plus low birth weight. E, postterm plus low birth weight.
D.
The right answer is A, as the baby has born at 36 weeks, so is preterm, and the weight is 2.3 kg, and the minimum range is 2.5 kg, so it is classified as low birth weight. The seventh MCQ: our district aims to meet SDG 3.2 by 2030. Which target is most relevant? A, neonatal mortality should be less than 20 per 1,000 live birth. B, neonatal mortality should be 15 per 1,000 live birth. C, neonatal mortality less than 12 per 1,000 live birth. D, under 5 mortality should be 25 per 1,000, and maternal mortality should be less than 150 per 1,000 live birth, per 100,000 live birth. So the right answer is C. This is the target of SDG 3.2, that by 2030, neonatal mortality should be less than 12 per 1,000 live birth. The eighth SCQ is: a newborn in a remote village needs urgent care. Which factor most influences the neonatal survival during referral? A, type of ambulance. B, speed and availability of transport. C, gender of the baby. D, distance to the district office. And E, vaccination status.
D.
Yes, B is the right answer. The speed and availability of transport. The ninth MCQ is: a preterm baby is stable, but facility lacks incubators. Which strategy best aligns with WHO public health recommendations? A, is to send baby home without guidance. B, kept the baby in a warm room only. C, initiate continuous kangaroo mother care. D, feed infant with the formula exclusively. D, delayed breastfeeding for 24 hours. The right answer is C, as the baby is stable, so we can initiate continuous kangaroo mother care. The last MCQ is: in a remote area, mothers report difficulty reaching facilities. Which universal health coverage component is most effective? Affected. A, quality; B, coverage; C, financial protection; D, service utilization; E, equity of access.
D.
And the right answer is E, equity of access. This is the key to all the MCQs. These are the references. This is the official channel of the Institute of Public Health, where the recording of this presentation will be uploaded. And thank you.
Thank you so much. It was a very informative presentation.
Thank you, Dr. Amna.